Alright, so I'm doing my presentation on bone cancer. My name is Jason Aquino. Alright, etiology. The bone cancer is a rare disease and it's usually idiopathic, which means there's no real known causes, but there are different factors that can increase the risk of bone cancer, including hereditary cancer syndromes. Um, Basically, it causes this downregulation of suppressor genes and upregulation of oncogenes, which basically just increases the amount of time that that increases the risk of cancer forming. Also, radiotherapy can also increase uh, the risk of bone cancer from forming. Let's see. Etiology. Again, Paget disease, it basically makes bones grow faster and also break easy, but it also increases the risk of mutations forming. Uh, Neoplasms can also later develop into malignant chondrosarcoma, which is a cartilage cancer, bone cancer. Osteosarcoma is the most common out of all the bone cancers. It usually forms in younger people, ages 10 to 30, and ages 1 in 10 in older adults. Ewing sarcoma, it's considered the third most common. It usually affects those that are younger, and also affects Caucasian people and African American, rare in African American and Asian Americans. All right, and demographics for chondrosarcoma, which is the early bone cancer and cartilage. It's usually in middle-aged and older adults. All right, so anatomy. Osteosarcoma usually forms in the long bones, uh, and also in chondrosarcoma, it's usually in cartilage cells, wherever cartilage is formed, such as the ribs or in the skull. Ewing sarcoma, it usually forms in the lower limbs or the pelvic bone. All right. So uh, these are images of a radiograph, and you can see the signal intensity, which shows an abnormal mass where the arrows are pointing at. And this was an image of an 11-year-old boy after he came in with a pain after falling in a football game, and after seeing the results, it was confirmed to be Ewing sarcoma. This next image is a 11-year-old boy with right knee pain after playing basketball. In images A and B, you can see swelling and formation of soft tissue. Later, it was confirmed that there was a development of tumor. In C and D, you can see it more, and it was later confirmed to be high-grade osteosarcoma. All right. So physiology. Physiology, it's usually grown during the formation phase. It causes bones to become weaker than usual, causes more fractures. It can cause swelling, and it can cause harder swallow. Let's call it disrupt the act of swallowing, breathing. In the spinal cord, it can cause paralysis and loss of feeling. Bone cancer can also decrease the range of movement because of the pain. All right. Symptoms. Main symptom is a long-lasting pain that worsens over time. Without treatment, it can be more constant and even higher. It can cause tenderness, a reduced range of motion. There's symptoms is signs of swelling or a lump in affected areas. Other symptoms can include weakness in bone formation, increase in bone fractures. Also, like any cancer, it can cause weight loss or fatigue or fever. So, in physiology, symptoms continued. There's a survival rate of 5 years, a survival rate of 66%, and lower rates in the UK. Survival rate 60-78%, can lower to 20% to 30% in patients with metastatic diseases. Presentation of for chondrosarcoma, it's usually 5 year 83%, but can lower to 53% in grade 2 Ewing sarcoma. It's a 5-year of 70 to 80%, but falls to 50 with isolated pulmonary metastasis, and can go to less than 30 with other metastatic diseases. Also, tumor size, location, the age of patient, and poor reaction can also affect the survival rate. Diagnosis: there's the MRI, CT scans, whole body bone scintigraphy, or plain radiographs can identify osteoblastic activity, which can lead to development of tumors. Blood tests can predict bone cancer. Tissue biopsy can be used for definitive diagnosis. Allows for histopathological assessment and for grading. Treatment, usually surgery. They try to remove the tumor to preserve the limb, but sometimes if the tumor the state is too bad, they have to amputate. Chemotherapy can reduce the rates of the bone cancer, but side effects include a range of things: anemia, vomiting, nausea, and including long-term effects include secondary cancers or hearing loss. Radiotherapy, it can only be used for Ewing sarcoma because it's radiosensitive, but for chondrosarcoma, it's radioresistant, so it can't be used for that. Radiotherapy can slow tumors and relieve pain, but it can also include secondary malignancies. All right, for artificial intelligence. Artificial intelligence can be used. Radiomics is one of the artificial intelligence. It's a medical imaging analysis method. It can scan multiple images. It can be used for complex reveal complex patterns and trends for diagnosis. It can be used for proper treatment methods. It can be used for basically to improve clinical outcomes. It can predict overall survivability, metastasis, and recurrence, and it can be used for therapy. All right, and here are the references. Okay.